Many Americans are not aware that they brush and floss incorrectly, which can cause tooth decay and a disease. I have a toothbrush, and when you're trying to brush your teeth, make sure you choose a soft bristle brush. Then I have my floss. I have my adult tooth model and my child tooth model. I'm going to first start off going to show you how to properly brush a children's teeth. Then I'm going to show two different toothbrushing techniques for adults. One is called the Stillman's toothbrushing, and the other one is called the Bass. Then after that, I will show you how to properly floss your teeth. Alright, here is my children's model. When brushing children's teeth, make sure, if you're a parent, that you can do it for them. If they're old enough, they can do it by themselves, but make sure they are doing it correctly. Again, make sure you choose a soft bristle toothbrush and just a pea size of toothpaste on the bristles. You're going to do big circular motions as so. You can open up and you can do big circular motions, about 2 to 3 teeth at a time. Make sure you do not do horizontal brush, and make sure you don't do it hard because that will wear away the gums. Also, make sure you do each side as so. Don't forget the back. And when choosing to brush the front back teeth, you're going to do vertical motions as so. And don't forget about the bottom. Now we're going to go to the adult toothbrushing technique. I'm going to start off with the Stillman's toothbrushing technique. And that is, you're going to have half of the bristles on the gums and half of it on the tooth. And again, you're going to choose 2 to 3 teeth at a time and do small vibrating circular motions as so. And again, do each side. Don't forget the back. And the front back, also do the vertical motions as so. And again, do not do vigorous horizontal strokes because that will cause abrasion of the gums. There is another version of the Stillman's, and that is called the modified Stillman's technique. And that's where you do the same as you do the half on the gums and half on the tissue, and you do the small circular vibrations, and then you add a sweep. Also, don't forget to brush the occlusal surfaces as so. Then we're going to show you how to brush your teeth if you have gum disease, if your tissues are not healthy, and that is called the Bass method. And that's where you tilt your toothbrush in a 45-degree angle into the gums. And you're going to do 2 to 3 teeth at a time in small circular vibrations, as so. And again, don't forget to do each side. And also, again, vertical motions for the front back. There's also another version of this method, of the Bass method, and that's called the modified as well. And that is where you also add a sweep. And you do tilt it, and then you add a sweep. And again, don't forget to do the occlusal surfaces. Also, with children and adults, don't forget to always brush your tongue. 80% of the bacteria is found on your tongue, so that's why it's good to brush your tongue. Now I'm going to show you how to properly floss your teeth. You're going to choose about 18 to 12 inches of floss, or you can do it shoulder length. Then you're going to wrap it around your third finger and grab the floss about 1 inch between your thumb and index finger as so. For the upper arch, you're going to insert it in between the teeth as so, and do not snap the floss in between the teeth. That would cause damage to the interdental tissue. You're going to make a C shape around each tooth in between as so. So it's going to look like this, a C shape around the tooth. Then when you're doing the lower arch, you're going to grab around your third finger as well. But you're going to push down with your thumbs, and you're going to make a C shape as well. And again, do not snap it in between the teeth if you have tight contacts. Just wiggle it in. You're supposed to brush your teeth for 2 minutes twice a day. And along with flossing, you're supposed to floss once a day. You can do it how many times you prefer, but once a day is all that is required. And we're going to do a recap for children. Big circular vibrations, and again, do not do horizontal. For the adult, you have the Stillmans. That is half on the gums and half on the tooth structure. Small circular vibrations, 2 to 3 teeth at a time. Then you have the modified, which is the same, but you add a sweep. Then you have the Bass method, and that is tilted at 45-degree angles, small circular vibrations. And then for the modified version, you add a sweep. And don't forget, do not do horizontal vigorous toothbrushing. That would cause abrasion as well. So 2 minutes a day, twice a day, and flossing. Remember, it's going to be shoulder width length, wrap around your third finger, about 1 inch between your thumb and index finger, and have a C shape around the tooth. All right, thank you.